So among things that can affect pharmacodynamics, it's what we call the dose-response relationship effect. So when we say dose relationship effects, it means simply this. You can give a patient a drug, and as the dose of the drugs increases, the response to the drug will increase. So if you give a patient more and more of the drugs, technically you can get more and more responses, right? You give 10 milligrams, 40 milligrams, 50 milligrams. So the more you increase the dose, the more response that you will get. So the more effect you will get from the drug, which is called the efficacy of the drugs. However, all drugs reach a maximum response. In other words, let's say you can give someone one Tylenol, you get a bit of relief, right? You give your patient 2 Tylenol, you get a relief. You give your patient 3 Tylenol, they'll get even more relief. But it gets to a point where taking more and more of the drug would not actually change the effect of the drugs. If after 4 Tylenol, you get the maximum response from the drugs, then even if you give 5 and 6 or 7, it will not change the effect because we already reached the maximum effects. So anything you will get by giving more and more, it will increase the risk of side effect or intoxication, adverse drug reaction, once you get the maximum response from the drugs. So efficacy, so you have those two terms here, efficacy and potency. Efficacy simply means the maximal effects that a drug can produce. It's the greater maximum effect a drug can produce. Potency, this is the amount of the drug needed to produce a specific response. Efficacy is the maximum effect of the drug can produce. And potency, this is the amount of the drug that is needed to produce a given effect. That's the difference. Now, look at the graph. You have x-axis here, and then you have y-axis here, the x-axis. So you have the doses of the drug here, 10, 20, 30, 40, 50, 60, all the way to 600 milligram. And in the y-axis, this is the degree of pain relief. This is technically the effect of the drug. And on that side, potency of the drugs. So you probably need 10 milligram, you probably need 20 milligram of the drug, 30 or 40 milligram. So we're talking about the potency of the drug on the x-axis. And if you take the y-axis, we're talking about the effect of the drug. In this graph, we have 4 drugs: morphine, we have Demerol, codeine, and then you have aspirin. Looking at the first curve, what do you see? We have morphine, a great pain relief. So everybody looking at the curve, it's going all the way up, maximum effects. In terms of efficacy, it has a strong efficacy. We can say that morphine provides strong pain relief. Now, take codeine. You can tell codeine will give you moderate pain relief because you can see its maximum effect is right here compared to morphine or Demerol. Now, we take aspirin. Let's say that aspirin is about 400 milligrams. At this point, we can say aspirin provide a mild effect because we all can appreciate that graph and understand what we're looking at. We can say that morphine has greater efficacy. What we're saying is the greater the maximum effects of the drug, the greater is efficacy. Some drug has high efficacy. For example, narcotic analgesic, antibiotic, antihistamine, or decongestants. Now, potency. You can see exactly the direction where the drugs go. Let's say I need to give about 2 milligrams of morphine to get this maximal effect you have. In the graph, if we're talking about potency, so think about potency to dose of the drug. We said potency, that's the amount of the drug needed for a given effect. Look at the graph. Look at Demerol. Compared to morphine, it is safe to say that Demerol produces the exact maximum effect as morphine. It provides the same pain relief as morphine. So in terms of efficacy, morphine and Demerol are equal. Now, look at the low dose. Look at the potency of the drug. How much do I need of morphine to get that maximum effect? Let's say here, it's 2 milligrams of morphine. And then look at Demerol. How much do I need of Demerol to get that maximum effect? So if we go 10, 20, 30, 40, let's say this is 40, you need about 40 milligrams of Demerol to get that same maximum effect. Now, which of those drugs is more potent? What would you answer me? Anyway, obviously morphine is more potent. Why? Because I need less same maximum effects. So morphine is more potent. The amount of the drug needed to provide a given effect. So example, high potency drugs, cancer drugs, those are already high potency drugs. antihypertensive drug, anti-lipid drug. This is the difference between potency and efficacy. Demerol and morphine has the same efficacy, but morphine is more potent. Now, again, the difference between efficacy and potency. Potency is related to the dose that you would give to produce a particular effect, and efficacy, this is the maximum effect that the drugs actually produce.